Hello, my name is Ashlyn. Today we're going to be doing a subcutaneous injection. We have our heparin, we have the alcohol wipes, gloves, gauze, and then we have our needle and syringe. This is the 25 gauge by 5/8. This is a 1 ml syringe. Before we get started, we want to go ahead and verify the 6 rights of medication administration, which is right patient, right drug, right route, right dose, right time, and documentation. For today's injection, we're going to be giving heparin, which is 1,000 units subcutaneous, just 1 dose. And what we have on hand is the heparin sodium injection, which is 10,000 units per 10 ml, so we do have to convert. So we would go ahead and convert this by dividing and then multiplying by the 10 mLs, which would give us 1 ml that we are going to be drawing up. So after we have confirmed our medication and the correct dose, we are going to go ahead and go into our patient room. So I gather our supplies, enter the patient's room, provide the privacy curtain, provide hand hygiene. Hi, Mr. Smith. My name is Ashlyn. I'm going to be your nurse today. Can you please confirm your name and date of birth? Thank you. I would go ahead and double check with his wristband. Do you have any allergies to medications or food allergies or any known allergies that we should know about? No drug allergies, so that's good. So we are going to go ahead and give you a heparin injection today. Heparin is a medication that is injected typically within your stomach area. This prevents blood clots and decreases the clotting abilities of your blood. Some side effects to look for, especially at the injection site, would be any abdominal pain, any abdominal bloating, any pain or irritation from the injection site. Some adverse effects that we want to watch out for as well is any blood in your urine, if you're coughing up any blood, any headaches. If you do experience any of these, please let us know immediately, and we can go ahead and take care of that from there. Do you have any questions for me before we get started? No questions? Okay, perfect. So what we're going to go ahead and do is we are going to don our gloves. And we're going to go ahead and take out our needle and syringe, and we're just going to draw up again the 1 ml because we're going to be injecting with air first. So that's prepared. And then I'm going to take my alcohol wipe and we are just going to cleanse the top of the vial here. I'm going to throw that away. Again, we are going to inject the 1 ml first. And I'm going to leave the cap here so we could do capping after. So once we have that injected, we're just going to inject the air, invert, and then pull out the 1 ml. And if there's any air bubbles, we can go ahead and push some medication back in to get rid of that air bubble. And we have the 1 mLs drawn up, and we're going to do the sweeping method and then cap this down. Again, we have 1 ml. So once we have this drawn up, we are going to go ahead and choose the appropriate site for injection. Again, this is typically injected in the abdominal area, so we want to go ahead and look at the patient's abdominal area for any bruising, inflammation, any edema, anything that would prevent us from not injecting in this area. If there is any of these noted once we examine the patient, we can go ahead and choose a different area for injection. Again, this is a subcutaneous injection. All right, Mr. Smith, I'm going to go ahead and lift your shirt. Skin looks good. Any tenderness or pain touching your abdomen area? Everything feels fine. That's great. Okay, we're gonna go ahead and clean a site. So we're gonna take this, and with cleaning, you're just gonna start from the middle, and you're going to counterclockwise clean outwards. We're gonna go ahead and throw this away, and we are going to let this dry. You do not want to wave it, you do not want to blow it, you're just gonna let it dry by itself. Once that's done, you're going to go ahead and visualize your site, and you're going to uncap your needle, and we're going to pinch it, and with injecting it, you want to go in at a 45 to 90 degree angle. So we're going to hold this here and inject and let go, and we're going to push in the medication. Going to withdraw the needle, and we can go ahead and cap this and discard this into the sharps container. Go ahead and apply the gauze. At this time I would have a band-aid. We can apply the band-aid if the patient requests it. You doing okay, Mr. Smith? You feeling okay? Okay, that's great. You are all set. Again, let me know if you start to have any sort of reaction. Here's your call bell, and we will be right in. Okay, I'll go ahead and apply hand hygiene, and then I will go ahead and document.